From the News Channel 5 Network, this is OpenLine.
Hello everyone, welcome to OpenLine. I'm Ben Hall. Good show tonight. A lot going on in the Tennessee General Assembly, as you all know. One of the things we've focused on is the expansion of Medicaid, Medicare in Tennessee, healthcare expansion, and Insure Tennessee. That has not happened, but there has been a lot of discussion about it this session, and a new study committee formed. We want to talk about that issue, and we are very happy to have with us someone who can help us discuss that. Andy Spears, Executive Director of Tennessee Citizen Action. Thank you for being with us.
Thank you.
We were going to have Republican Mark Green, Senator Mark Green from Clarksville. He is a doctor. He was going to talk about this. But there's a lot going on with the legislature. His legislative duties have kept him away. We are happy, though, to have Andy Spears with us. First of all, Tennessee Citizen Action. What is that?
Yeah, Tennessee Citizen Action's been in Tennessee for about 20 years now. We are a consumer advocacy organization. We focus on consumer rights, consumer fairness, and one of those issues that we think consumers should have is access to affordable health care. And so with the Affordable Care Act, a lot of consumers got that, but there are about 280,000 Tennesseans caught in the coverage gap. And so one of the things we've talked about the last couple of years is Insure Tennessee. Governor Haslam unveiled it last year. Like you said, it's been discussed a couple of times. But we believe Tennessee consumers should have choices, and Insure Tennessee would provide a choice. There was
a special session, and in that special session, it failed. It never was even voted on by the entire legislature.
Right.
It failed in committee. Mm-hmm. And then what happened this year? What happened just last week?
Well, so last week, Speaker Beth Harwell announced that she is forming a task force of key members of the legislature to study what she's calling a three-star healthy plan, a new way to provide health insurance to Tennesseans. What is frustrating from our perspective is we've had 2 years to talk about Insure Tennessee. This is a plan that would not increase taxes at all. It doesn't cost the state of Tennessee anything. In fact, it brings back our federal dollars. It makes people who work and are in the coverage gap pay some money to have a stake in their health care claim. So it's a very, you work, you pay a little bit, you have some skin in the game. It's a plan that the hospitals have said when the federal government backs out, they're going to pick up the cost. So taxpayers will never pay a dime for this plan that can provide health insurance to Tennesseans. It's a very conservative plan, it's a very Tennessee plan. Governor Haslam developed it independent of the president and got a waiver from the federal government to do it. So we think this is a good solution for Tennesseans. We don't need another task force of legislators to talk about it. All the way up until last week on Wednesday, we thought that Speaker Harwell might announce that she was going to move the bill directly to the floor and at least let us have a House floor debate on Insure Tennessee. That didn't happen, and instead we've learned we're going to study it for a little while, and they may come up with a plan, or they may not. We'll see.
What she has said is that there just isn't the support, that in this political climate, even though it's put forth, this plan is independent of the federal government and was put forth by the Republican governor, that there's just not the support. So I think what she's saying is, let's send it back to a committee, and let's see if we can come up with some alternative, some adjustment, tweak it in some way so that there can be support.
Well, let me say this. So the people that she's picked to be on the task force, if they will support a health care plan, that's the plan that can pass. So she's done a good job of picking the people. That's important. But we have a plan that, like I said, isn't going to cost anything, is very reasonable. It's a very conservative plan. It's a Tennessee plan. It rewards people for being healthy. It rewards people for having a stake in their own health care and paying for it. There's no reason why we couldn't have had that discussion in a larger context in the House. And you're right, last year in the Senate there was a committee vote. There hasn't been a discussion at all in the House, and there should at least be a discussion among House members. We may have gotten to the same result. There may have been, if she's right, there could have been a vote, and we could have seen that there weren't 50 votes today or this week for that plan. But every House member should have had a chance to vote for it. And it's kind of shocking to me that in a Republican supermajority, you can't pass a plan that's supported by the Republican governor and that the Republican speaker has said good things about, but they can't get 50 people to support it. Every Democrat has basically said they're for the plan. They only need 24 other people besides the Democrats to vote for it out of 73. That's a third of their caucus, and they can't rally those people together. That's disappointing in terms of her leadership.
So you actually point to her leadership. You
Absolutely.
think if she twisted arms, that it could happen?
Absolutely. If you're the Speaker of the House, then you trade favors and you make deals. This is an important issue. We spent 2 hours today talking about overriding a veto of the state book and whether or not we should get into some sort of lawsuit.
Whether the Bible should be the state book.
Right.
That is what we talked about.
And so we talked about that, and we spent 0 hours this session talking about access to health care for 280,000 Tennesseans. And at the very least, we should have had a discussion in the House. And so she said, well, we're going to fall back on the rules, and we're not going to do that. And I think at the very least, every House member should have had a chance to vote. If the votes weren't there, let them vote and let's see. And this is a political escape hatch in an election year, and that's not leadership.
So where do you think Speaker Harwell is on this? Does she support it?
I think if she supported it, we would have had a discussion in a committee. The Speaker and the Speaker Pro Tem are allowed to vote in any committee. That happened many times when Speaker Nafee was the Speaker and there was a tight vote. She has rarely exercised that power, but I think if she really wanted something to happen, she could have at least advanced it through the committee process if she was for it. So, she may be for a health care plan. It seems to me that she wasn't willing to support this plan.
Now, the political reality, though, this is tied to the Affordable Care Act, Obamacare.
Right.
In this state, that's wildly unpopular. Really, the discussion for some stops right there.
Sure.
How do you get past that?
Well, one of the things that I think is interesting is Tennessee has 2 U.S. senators, both of whom have been willing to work with the president. Senator Alexander just got passed a major overhaul of the Education No Child Left Behind Act, bipartisan, worked with the president and his Secretary of Education, Arnie Duncan, worked with Senator Alexander on that. And I don't think there's any serious challenge to Lamar Alexander coming anytime soon in Tennessee. Joe Carr tried that, it didn't work. So I think you can work with President Obama or say President Obama, and it's not necessarily terrible. And this particular plan was created by Governor Haslam. He was very clear about it not being a traditional Medicaid expansion. They did traditional Medicaid expansion in Kentucky. This is different than that. There's, like I said, people have to pay part of the premium. There's incentives for healthy behavior. Lots of differences between that and traditional expansion. It truly is a Tennessee plan, and I don't know why you can't get the votes for that. So, Bob Corker and Lamar Alexander worked with President Obama and seem to be getting reelected just fine. I think state legislators can do the same thing if they're willing to do it. And the experience in Kentucky is the people who got Medicaid expansion there are benefiting from it. It's good for their economy. They're recovering their federal tax dollars. That could be happening here, and I think voters will reward people who are willing to step out and take that risk.
The other criticism that I hear is the expense. They say that, okay, sure, the federal government pays in the beginning, but then years down the road, we're left holding the bag.
Right.
And so there's this concern about the expense.
So there's two things on that. One, the hospital associations of Tennessee, a couple different associations have said when the federal government money runs out, they would pick up the cost. It's about 10% of the cost. The second part of that is the initial Insure Tennessee plan is a 2-year pilot program. So that allowed us to look at what's going on after 2 years, what are the requirements, do we need to rein it in some or change eligibility? It was definitely laid out in a way that was probably smarter than the way TennCare was laid out, because that was very risky and kind of ran away in terms of who was eligible for it. This gives us kind of a 2-year check-in. Hey, how's it going? How much is it costing? Can we afford it going forward? But the initial 2 years, totally free, paid for by the federal government. Hospitals agreed to pay for the rest of it. That's a good system. And it gave us a check-in to say, if this isn't working or we need to change requirements, we can do that.
And that is something that I think people don't hear, that the hospitals have agreed to pay.
Yes.
So if the federal money is cut off, or there is this, they pay 90% and then after a few years they cut back or whatever, the hospitals have agreed to pay. Why would the hospitals do that?
Well, the hospitals agreed to pay because they want patients who have access. First of all, their first goal is to have patients have access to coverage. Second, insured patients are much more likely to pay their insurance bills. So when they see a patient who doesn't have insurance, they present in the ER, they're just writing that expense off because that patient's never going to pay the huge ER bill. When that patient comes in with an insurance plan, Insure Tennessee, the hospital's going to get paid. Even if they're having to put up a 10%, basically a 10% premium on that, they're getting 90% of their money back. So it's a good deal for them than putting in $10 or putting in $1 and getting $9 back.
We've heard that hospitals may have to close and that in fact they will close. And I want to talk about that, the economics of all this, and start taking some calls. We have a couple people on the line. If you're on the line, hold on. We will get your call. If you want to call in, there's the number, 615-737-PLUS, 615-737-7587. We'll take a break. Be back right after this.